Okay, so the main things that you need to know about stains, I think you guys have gone over quite a bit to do with stains in the last couple of years with the CLP and Dr. Baker. So the main thing is Romanowsky type stains are for air-dried slides, so slides that we take the sample, quickly let it dry, and then go ahead and stain it. Papanicolaou stains are for immediately fixated slides, so wet to wet slides. Your Romanowsky type stains, like I said, for air-dried slides, so that includes your Wright stain, your Gemsa stain, your Diff Quick stain. They're easy, they're readily available, you can get them through vet purchasing, no problem, and CDMV. Good nuclear and nucleolar detail, excellent cytoplasmic detail, microorganisms are shown, such as bacteria, mycotic figures, and they're pretty cost effective. If you think about our Diff Quick, most clinics have a Diff Quick stain. Papanicolaou stains are for immediately fixated slides, so that means that you don't let your sample dry at all. So it's a wet sample that goes straight into a stain for excellent nuclear detail. It takes a considerable amount of time, so it's pretty impractical to have at a regular clinic, whereas you'd have it particularly at a specialty lab or a university lab. The main thing with Papanicolaou stains is that they create excellent nuclear and nucleolar detail. So in the time where you might be looking for perhaps criteria of malignancy, where the nucleolar detail is of specific importance, then the Papanicolaou stain might be the best one to use. And since we don't use the Papanicolaou stain, this is something that we would send to the lab an unstained, just an unstained slide, and perhaps they would use a Papanicolaou, but at the same time, the ideal is to have it wet before they go ahead and stain it. So normally it's with immediate use between the time of taking the sample and getting it stained right away. It creates okay cytoplasmic detail, and microorganisms are not readily demonstrated with the Papanicolaou stain. This is how you use Papanicolaou stain. So let me just, oops, sorry. Okay, so this is the whole method. So 96 degree, I believe it's supposed to be percent, ethyl alcohol for 15 seconds, and then 70% ethyl alcohol for 15 seconds, 50% ethyl alcohol for 15 seconds, then distilled water, then Harris hematoxylin, and then distilled water, hydrochloric acid, distilled water, ammonia, ethyl alcohol, you get the point. It's an incredibly time-invasive stain to use. And also realistically, which clinics would need to have this stain other than referral clinics, especially perhaps oncology clinics where they may be taking the sample and then going ahead and looking for that nucleolar detail. But realistically, to have this in a clinic, it would be not very cost effective and not very efficient time-wise. So just a comparison between the two stains. For your dry smear, air-dried smear, excuse me, you'd want to go ahead and use a Romanowsky. And if you used a wet fix smear with the Papanicolaou, then your artifacts are fairly common, so your secondary artifacts. For your wet smear, artifacts are common if we use a Romanowsky, but for the Papanicolaou, it's better fixation. Cytoplasmic detail is much better demonstrated with the Romanowsky type stains as compared to the Papanicolaou. Nuclear detail, you can get different patterns with the Romanowsky stain, and the absolute best, the highest standard, would be with the Papanicolaou. And that goes the same with the nucleoli as well, the nucleoli detail. And stromal content is well demonstrated with the Romanowsky type stains and poorly demonstrated with the Papanicolaou. Romanowsky type stains are often used when identifying changes in the nucleus, right? So we will use our Romanowsky type stains when we're talking about criteria of malignancy. However, for the absolute best in nuclear detail, if they're looking at specific chromatin patterns, and then secondary if they're looking at nucleoli definition, the very, very top standard would be to use Papanicolaou. And the effects of an ideal stain on your sample would be artifact reduction, and that includes drying as well, any sort of water staining or anything that could happen in the drying process. Good nuclear cytoplasmic ratio, so to be able to actually identify that with your stain, whereas if you have poor cytoplasmic detail, you wouldn't want the two to blend into each other. Chromatin pattern and color, so very specifically, if they're looking for specific chromatin pattern and color, then they would typically stick with the Papanicolaou stain. Nucleolar appearance, cytoplasmic features, and extracellular matrix visibility and color. And that's it for stains.